Welcome to the spoken tutorial on the complications of using nipple shields. In this tutorial, we will learn about nipple shields, disadvantages of using nipple shields, suggestions for adequate breastfeeding. Let us begin. A nipple shield is used to help with breastfeeding. It is a nipple-shaped cover made of plastic, silicone, latex, or other materials. While breastfeeding, it is positioned over the nipple and areola. It is a temporary solution to help the baby latch onto the mother's nipple. Nipple shields are usually recommended to mothers who have flat nipples. They are also recommended to mothers who have inverted nipples. They are also used when the baby doesn't latch on or suck the breast properly. Mothers with cracked nipples also use them to avoid pain. However, use of nipple shields during breastfeeding has many disadvantages. They create a barrier between the infant and the mother's breast. They make breastfeeding feel unnatural. They reduce the stimulation of the areola. This may interfere with prolactin and oxytocin release in the mother. Prolactin and oxytocin are hormones needed for lactation. Prolactin helps in breast milk production. Oxytocin helps in releasing milk out of the mother's breast. Therefore, nipple shields reduce breast milk supply during breastfeeding. This increases the overall time taken for breastfeeding. The mother and the baby feel tired after feed. On long-time use, the infant becomes dependent on nipple shields. Infants may refuse to breastfeed without a nipple shield. This dependency, combined with reduced breast milk supply, is not good. Over time, it decreases breast milk production. Therefore, it causes early weaning. Early weaning is found among many mothers who use nipple shields. Nipple shields prevent the nipple from reaching deep inside the baby's mouth. This does not let the baby deeply attach to the mother's breast. This might also interfere with the baby learning to suckle correctly. The baby's suckling pattern is changed when a nipple shield is used. Nipple shields increase the baby's sucking speed. They also increase the baby's time spent resting during breastfeeding. The baby might swallow too much air because of the nipple shield. Nipple shields often fall off the breast, thereby interrupting breastfeeding. Nipple shields give a feeling of inconvenience to the mother and the baby. It is difficult for the mother to clean them later after use. Hence, they increase the chances of passing the infection to the baby. A nipple shield with an improper hole gives poor flow of milk. This can tire the infant and cause poor growth. Sometimes nipple shields of improper size or fit are used. They can cause choking in infants. They can also cause or worsen cracked nipples in the mother. Nipple injury from squeezing of the nipple and areola is possible. Nipple shields should not be recommended if the baby is not sucking properly. The current research does not yet show safe practices for using nipple shields. Some experts recommend nipple shields when the baby refuses to breastfeed. Causes for refusal may include flat or inverted nipples. They also include premature birth. Another cause is the baby not sucking the mother's breast properly. Other causes are neuromuscular issues or imprinting. Imprinting is a behavior that happens in the early hours of life. Ideally, the baby naturally attaches to the mother's breast after birth. However, without early breastfeeding, the baby attaches to something else. It could be a thumb, bottle, plastic nipple, etc. This causes the baby to refuse to breastfeed. Sometimes a mother may be stressed. She may be considering bottle feeding. In such cases, nipple shields may provide temporary relief to her. They may also prevent bottle feeding. She must be helped by a lactation expert properly. Some mothers may wish to use nipple shields for longer periods. However, they must go for regular follow-ups to check if the shield is helpful. Here, the risk of the baby not feeding directly from the breast is high. Self-made nipple shields should not be used. Nipple shields should not be altered for use. Sometimes a mother may ask about using a nipple shield. It is important to first ask her about her breastfeeding technique and problems. Enquire about her breastfeeding history. Enquire about her attempts to correct the baby's breast sucking technique. Then offer suggestions to correct the mother's breastfeeding technique. Nipple shields should only be initiated by a healthcare provider. They should be an expert in breastfeeding skills. They should thoroughly assess the benefits and risk of using a nipple shield. They should also plan with the mother for regular follow-ups while using it. Babies can get used to breastfeeding with a nipple shield. Later, they may refuse to breastfeed directly from the breast without a shield. They may also not be able to attach deeply to the mother's breast later. Therefore, follow-up is especially important in the first 48 hours. Mother should be helped to wean from the use of a nipple shield. Some healthcare providers cannot help the mother appropriately. They should refer her to a lactation expert. Mothers should always be taught the proper techniques of breastfeeding. She should know that babies must attach to the lower areola, not to the nipple. So, it is not mandatory to have a protruded nipple for the baby to attach. Most often, the nipple can protrude naturally with the help of deep latching. This happens over a few days due to good sucking by the deeply latched infant. The use of nipple shields can make this natural process difficult. Initiating breastfeeding within 1 hour of birth is important. To do so, skin-to-skin contact must be performed immediately after birth. Skin-to-skin contact after birth is explained in another tutorial. Mother should also learn the correct techniques of breastfeeding. Cross-cradle hold is one of them. This hold will help in adequate breastfeeding even if the mother has flat nipples. In this hold, the mother's fingers on the breast are parallel to the baby's lips. This helps the baby latch deeply to the breast. Cross-cradle hold is explained in another tutorial of the same series. Patience in learning breastfeeding skills must be encouraged. Repeated attempts must be made to breastfeed without a nipple shield. Remember, exclusive breastfeeding for the first 6 months of life is crucial. Breastfeeding must be effective for the baby's growth. Correct breastfeeding techniques will ensure that the baby gets enough milk. Any artificial product can never replace natural breastfeeding. An expert must always guide a mother to learn proper breastfeeding skills. This brings us to the end of this tutorial. Thank you for joining.